Foundation. So my name is Amy Berman. I am a senior program officer with the John A. Hartford Foundation in New York City. This is a national foundation. We fund all over the country. And I'm a nurse by background as well, but interprofessional to the core. So what I'm going to talk about today is a movement called Age-Friendly Health Systems. And this is an opportunity for everyone who is engaged in supporting the health of older adults to be involved. And I'll talk a little bit about that. And I just want to say a special welcome to my dear friend, Rini Carniel. I don't know if I know many of you on this meeting, but I do have a great love for Rini. And if Rini represents all of you, let me tell you, you are all winners. So let's see, hopefully the slides will advance. Good. Okay. So a little bit about the foundation before we start in. The John A. Hartford Foundation is a national foundation, was established with monies from the A&P grocery stores. Let's get that out. Okay, just hit close, hit delete up in the corner. So this came from A&P grocery store money. John A. Hartford was one of the initial CEOs of the A&P food store chain. A&Ps are long gone, but their monies became a private philanthropy, and our entire focus is on improving the care of older adults. And in terms of our focus areas, we do work around making the health systems themselves age-friendly, do work around support for family caregivers, and also work dedicated to improving the care of the seriously ill and those at end of life. So those are the areas that we support. How much have we supported? I don't know what the current number is. It's about $700 million. So more than $500 million in terms of support for improving the care of older adults and grants all age-friendly health. So let me just share my screen.
Thanks for being flexible, Amy.
Oh, of course, of course. It just, tests whether or not I had sufficient caffeine this morning. So good morning, everybody. I'm so glad you are here, or I'm so glad you're back. We're going to talk about the Age-Friendly Health System movement. I am Amy Berman. I'm a senior program officer and a nurse by background with the John A. Hartford Foundation, which is a national foundation. We support care of older adults, improving the care of older adults. And we do it in 3 different areas: improving age-friendly health systems, support for family caregivers, and work around serious illness and end of life. So we're going to focus in on that yellow circle, age-friendly health systems. And there are many grants in this area, but I'm going to talk about one which is actually called Age-Friendly Health Systems. So before we start, I think everybody knows about the demographic shift. Everybody who's in our meeting, we're all the choir. We care about older adults. And in healthcare, we know that as older adults age, we also are going to get a more diverse population and more complexity in terms of the care. So older adults are skewing older. What that means is that it won't just be the younger older adults, it will be the oldest older adults. So much more chronic conditions, dementia, frailty, social isolation, and inequity. And disproportionate harms happen to older adults. They will happen to a greater degree as people become more complex. So the other challenge that we have going on with the aging, when we look at what we know provides good outcomes in terms of care for older adults. If you look at the leading models of care that are highly evidenced, they are unlikely to be deployed. So here you see on your right, these 2 bars. You see the lower bar, the 8.7%? Well, if this is you, your parents, people that you care about that are older, less than 10% are likely to get those evidence-based models. This is shocking, and this is according to the leading experts. And it's because it's very difficult to determine which models do we take up. And so they're very poorly spread. So it is unlikely that the things that we know actually happen in healthcare. And this is the impetus for the movement. So we decided it's important to build an approach that can be taken up very broadly to make sure that all care is age-friendly and also equitable, that it's equitably applied so that it's not for some and not for others, and that an essential set of practices known as the 4Ms are provided, and they are consistent with what matters to the older adult. And I'll say more about that. So this is an initiative funded by the John A. Hartford Foundation. The Institute for Healthcare Improvement leads this work in partnership with the American Hospital Association and the Catholic Health Association of the United States. So the 4Ms is a framework that is used in this movement. And the 4Ms for age-friendly care are what matters to the older adult, eliciting and acting on what's important to that person. Medication, and I'm sure you know that this is part of almost every evidence-based model, so assessing and acting on things related to medication. Mentation, we're talking about delirium, dementia, depression, and mobility. And when I say mobility, I'm not saying falls. I'm saying things that support active mobility, improving function. So as a result, you're less likely to fall, but to really focus on that mobility. And you know, everybody who's in this meeting, you know, you may be in a community-based organization, you may be in a hospital, you may be in different settings or have work that you're doing in those different settings. But when we talk about mobility, for example, a typical hospital will evaluate an older adult with an assessment, give them a special colored wristband, put a star over their bed, call them a falling star, and immobilize them. And that may save the hospital from having a fall, but that immobilizing them reduces their function. So when they go home, they're more likely to have a fall. So they create more ability to have falls. So focusing on the mobility in every setting, including the kitchen table, that's why we say mobility, not falls. So why the 4Ms? Because these represent core issues, strong evidence, it simplifies what it is we need to look at, and the components are synergistic and they reinforce one another. So across the country, more than 2,800 different sites have been recognized in this movement. And the Institute for Healthcare Improvement not only helps lead implementation and provides free technical assistance around that. And I'll talk to you about how you can take up that information. But more than 2,800 sites have formally been recognized. The goal was 2,600 by June of 2023, so we've already beaten that. And data from the sites, more than 1.7 million older adults have received age-friendly care. Now, remember I talked about those 4Ms, what matters, medication, mentation, mobility. Each one of those things is done by some everywhere. So this kind of work is done, but it's not done reliably. And the innovation is doing them as a set. So well, I'll say a little bit more in a minute. In New Jersey, by the way, we already are underway with sites already recognized as age-friendly health systems. So we have 28 sites as of the last time I checked. I'm sure that we are even above that number now. So New Jersey is underway. These can be hospitals, outpatient clinics, primary care, PACE sites, nursing homes. They could be community organizations, a AAA. So all of them participate in an action community and achieve this level of recognition. So New Jersey, you're already representing. There's definitely more to be done. Let me just say that this age-friendly health system movement also really requires dedicated work around ensuring that we are equitably delivering this care. This is not something that places that are more resourced should be better at providing this care to certain populations. It's incredibly important that all people have access to the right kinds of care regularly. And if you know anything about geriatric expertise, it's not equitably applied. So really, this kind of a movement allows places everywhere to be able to provide competent care in a specific way. And so we have an equity task force led by Faith Mitchell. And this equity task force recommends collection of measures and by race and ethnicity to really see for these places to see whether or not they are equitably delivering on the promise of age-friendly health systems so that we are closing gaps in disparity. And there are community and health system partnerships in this effort. So US Aging and the Aging and Disability Institute have developed a crosswalk around the 4Ms, age-friendly health systems, the 4Ms framework for community providers. So helping them understand in their own work how they can be delivering on the 4Ms for older adults. And that's why oftentimes they will join along with health system partners, you know, hospitals, nursing homes, and others to work together so that the community-based services are supporting the 4Ms in the same way that the healthcare entities are also providing these services. So there are opportunities to join in the movement. I wouldn't be telling you about something that you couldn't do. And here, there are action communities. These are online monthly webinars and technical assistance that help places understand what they're already doing well. They may already be doing things around mentation and mobility and what matters and medication, but where they're not doing it well, it helps them complete their approach to building reliable age-friendly health system implementation. And anyone can join one of these action communities. There are action communities every 6 months. So there's a fall and a spring one that happen. The fall one, there are signups available right now. And all information related to the age-friendly health system movement, including implementation guide, return on investment calculator, and specific implementation around the electronic health record and setting specific information. It's all available for you on ihi.org/age-friendly, including registering for the current action community or the one that's coming up this spring. These are opportunities for you as you're thinking about other initiatives, including, New Jersey age-friendly efforts. Healthcare is part of that. So this is one of those components where you then become part of a larger whole in supporting better care for older adults that also meets with their needs, that understands what's important to them and supports that in the delivery of their own health care. So this is an overview. I'm certainly very reachable, but information on the movement is available on the IHI website. And this is really our opportunity to talk. I'd love to hear from you about what's important to you, questions that you have. So really take yourself off mute, feel free, and let's have a dialogue.
Amy, it looks like there's some questions in the chat. I don't know if you can access that yet.
I will pull it up. Let's see. Okay. Can you share the list of New Jersey organizations that are recognized? Well, in the slides, which you're going to be receiving, the slides have, under that map, they actually have a link. And that link allows you to look not just in New Jersey, but anywhere in the country. And when you hover over a dot, it will say what the name of that place is. So do a little dot hovering and you can find out if your local places are already recognized, or you can nudge them, say, we need a dot here. And this is how you can come and join. Let's see. How do we connect the age-friendly health system to the local age-friendly community work our groups are funding? So we are really engaged with creating what many of us call the age-friendly ecosystem. So this is age-friendly communities, age-friendly states, the work that Rini and Julia are supporting around Northern New Jersey. AARP is supporting nationally. The World Health organization is supporting. And then there's also age-friendly universities, age-friendly public health. We actually are funding another aspect of this that is building age-friendly public health systems where for public health entities to get accredited, so the state and county public health entities, they're now going to have to meet a new set of age-friendly elements in order to be able to achieve their accreditation. So that work started in New Jersey and is going on with other states now. But we do work together. We love to work together because you need to have all of these elements in place, not just one of them. Depending upon who you are, you may be involved in a number of them. So couldn't be more excited. Julia said, how do you encourage a hospital or other healthcare facility to engage in this model? Well, I think there's a sense of co-opetition. If you're not showing up on these maps, if your dot isn't there, there's consumer demand. People, families are, want to see that people that they care for that are older adults are going to a place that have age-friendly health system recognition. The American Hospital Association as a partner also puts out a regular drumbeat to trustees on the hospital boards, to in AHA Today, and case studies showing the outcomes related to this work in large, small, critical access, Indian Health Service, all kinds of places, FQHCs, and not just hospitals. I've said hospital too many times, and hospitals are not the be all and end all of the healthcare system. They are a component, but home care agencies, we are about to start prototyping home care for the age-friendly health system movement. So expect that within the next year. And CHAP, which is the Community Health Accreditation Partner, the major accrediting body for home-based care, hospice, home health, they will be prototyping, building that into a voluntary accreditation. So there are lots of things going on. For those of you who don't know, the federal, it's called HRSA, Health Resources and Services Administration. They are also funding all of the geriatric workforce enhancement program efforts, if you're related to this, which trains primary care clinicians. They must implement the age-friendly health system 4M's framework and be recognized. So there's federal funding around doing this as well. Am I missing questions? You can say your question. You can take yourself off mute and share a question or a comment or anything.
Kathy Cosma, North Jersey Villages and the Village Movement.
Hi, Kathy.
I see the villages very much in parallel, and many of them work in partnership with hospitals and home healthcare agencies. So although the village model would focus on the non-medical needs, certainly the what matters to older Americans is their older aging adults matters most to them, and they look to empower and enable them to fend for themselves in aging in place. And certainly mobility is a big factor there, not only in transportation, but other areas of assistance for seniors aging at home. But the medication, and although medication would be part of it in identifying and helping to address, if you see in village members, oncoming dementia or other disabilities, that they could identify that and then move on to a partnership with treatment and management and training on how to then work with that village member in being able to age again, to be able to age at home. So
yeah, I think that's brilliant, Kathy. If you'd like to have a conversation offline, I'd be very happy to talk further about it. But you're right. Depending upon what your role is and resources in terms of, who you have on staff and what services already are there, you could think about those services in terms of the 4Ms and how to, how to build this in. But happy to talk to you about this.
That would be great, and I'd like to include Barbara Sullivan, the director of the Village to Village Network.
Okay, well, my email is at the end. You're welcome to leave, an email because I don't have your email. But always welcome to reach out, and thanks for what you're doing at the villages. Any
And
other questions?
thank you, Amy. You're amazing. Your models are outstanding for anyone who's ever worked with a Hartford funded model. The amount of detail and quality measures are not to be beat. And it's been a pleasure to be able to promote models of care that the Hartford Foundation has led and really promotes across the nation in such a broad-based and usable manner. So thank you.
I'll just do a Valentine to Rini, because right back at you, all of the great work that you're doing. I couldn't be more appreciative of you as a human being.
Well, a real leader. Thank you.
Well, I know that